Welcome back to Choices. My name is Cameron Moffatt and I'll be the host for this evening. Autism spectrum disorder is a developmental disability that can leave the person with this disorder socially, communicatively, and problem solving very challenged. It's been often said that people with this disorder have no apparent physical obvious symptoms, and yet the person with autism or autism spectrum disorder can often be very challenged both socially and in a way of problem solving. The degree of this spectrum is so large that some people are actually considered gifted and others are considered to be severely challenged. And in a recent article in the Globe and Mail on March 27th of this year, the article quoted the US government as acknowledging that there is now 1 in 68 children dealing with some aspects of this disorder. And that's a 30% jump from 1 in 88 when the last data was collected. Here in Canada, our data supports pretty much the same findings. So with us on the show today is Anke Zimmermann, who is a naturopathic physician who has gone on to study in postgraduate work ways of treating autism. And we have her on the show tonight to help us understand this and to explain to us her treatments. So Anke, thank you for coming on the show.
Well, thank you so much for having me. It's a pleasure.
I'm very intrigued by your approach to autism and some of the results you've been having. Let's start off, first off, what got you intrigued with autism? Why have you sort of decided to do postgraduate work in that?
Well, it started way back in naturopathic college, actually, when I was briefly dating someone who had an autistic son. And he essentially cured his son of autism at the time using nutrition and energy healing. And it left an impression on me. So right from the beginning when I started practicing, I saw many children with various developmental and behavioral disorders and quickly became very intrigued in that whole area of practice because it had such a huge impact on the families. You know, the disorders had a huge impact, and helping those families, of course, is extremely helpful for everybody. And things just continued from there. I always had a large pediatric practice. And then 3 years ago, I came across the work of a Dutch medical doctor and homeopath named Tino Smits, who developed a whole system of treating autism using homeopathy and nutrition, which he called cease therapy. I read his book and immediately knew that this was going to be a huge step forward in my repertoire of techniques to use for the treatment of children with these kinds of conditions.
Okay.
And I took additional training in order to be certified in this therapy, and have been working with it ever since with dramatic
Now, how does
results.
this differ than
How
the
does this
typical?
differ? Yes, thank you. So my specialty was always homeopathy, and you know a little bit about homeopathy. Homeopathy is based on the idea that a substance that can cause symptoms in a healthy organism can also be used to treat similar symptoms in one who already has the symptoms. The classic example is usually onion. You know, let's say you cut up an onion and the vapors start to irritate your eyes and mucous membranes, and your eyes start running and your nose starts running a little bit. So if somebody already had those symptoms, let's say because they had hay fever or a cold, they might improve by taking a homeopathic preparation made from onion. And the remedies, the homeopathic remedies, I have something here for us to show, are made by a process of sequential dilution and shaking. So they don't actually, for the most part, contain any of the original molecules. Yet in some way, which we don't completely understand, they seem to stimulate the organism to reset itself or heal itself in some way. So what Tino Smits discovered, I had already used homeopathy successfully in practice. What Tino discovered was that children who had been affected by vaccinations or antibiotics often developed certain kinds of symptoms, let's say eczema, asthma, skin rashes, ear infections. And he found that when he gave those children remedies made from the homeopathic remedies made from those vaccines or antibiotics, that they improved. And he noticed that not only did their physical symptoms improve, but they also improved intellectually and behaviorally. And that's when he started to wonder if autism and related developmental disorders were not in some way caused or contributed to by these kinds of medications and vaccines. So he developed a whole system around that, essentially, using these homeopathic remedies to detoxify various causative factors that may lead to autism in different children.
Well, you know, there is some anecdotal evidence that points in the right direction that autism is not noted in the developing countries.
That's correct.
It is really rampant right now in our countries.
Very much so.
To the point where my research was showing before you came on the show that some of the health practitioners working in the field, either in research or in treatment, are now calling it an epidemic.
Oh yes, absolutely. Well, the rates are increasing by about 17% a year. As you mentioned earlier, it's now about 1 in 68 children being diagnosed. But that is actually old data. That is data from children who are now 12 years old. So actual current rates are much, much higher. There's a 1-year waiting list now at Queen Alexandra for autism assessments.
1 year waiting list?
1 year. And there are now private services springing up to help people assess their children for autism in order for them to access the help that they can actually qualify for.
That must place an enormous emotional strain on the parents.
It's terrible for the parents. It's really very devastating for the parents. That is one of the most devastating conditions. You know, here you have a child that is diagnosed with a potentially lifelong, extremely disabling condition. It's a really serious situation.
So tell us some of the case studies that you've done.
Yes, actually I brought a case, and this is an interesting case, a little boy. His name is Freddie. The family has allowed me full use of all the materials because they're very happy with the results. So this was an unusual situation. This little boy received his, he was a healthy little boy, he received his 1-year shots at 1 year, on November 19 of last year. Within about a month, he developed eruptions around the injection sites on his arm, small eruptions. Within about another month, those eruptions started to spread and fester, basically. They took the child to the doctor, and the doctor actually admitted that there was probably a reaction from the vaccination, and this was actually the chickenpox vaccine. The doctor prescribed cortisone cream, and the child had a reaction to the cortisone cream.
Of course, yes.
Yes, well. Within another month, the eczema had essentially spread to the rest of his body. And by the end of January, so this was January 22nd, by the end of January, he started to bang his head. He developed diarrhea with black and green stools. He refused to sleep. It became very aggressive, started perspiring excessively, stopped making eye contact, and refused to eat his food. And he started toe walking. So on February the 1st, I received a call from the father who had just found my name on the CEASE therapy website. And he explained the situation, and he said, "Can we come and see you today? I think my son is becoming autistic." And I said, "Yes, come on down." And they came all the way actually from Up Island, 3 hours to come to my office. And immediately, I mean, I knew what was happening essentially. So I assessed the child, and I started treating him with a homeopathic remedy made from the chickenpox vaccine.
Right.
As well as a few other things. I also gave him fish oil and vitamin C and so on. That's all part of CEASE therapy. And within a few days, he started eating normally again, stopped banging his head, and started to recover.
Wow. So excuse me for a moment. So
yes,
the CEASE therapy is not then just homeopathics. You're also supporting
exactly.
it with other
things.
things.
Thank you very much for pointing that out. So Dr. Smits realized that many other factors are also helpful in the treatment of autism. You know, so one of the first things we usually do is change the child's diet, improve their diet. It doesn't necessarily have to be gluten and casein free, but as healthy as possible. We use 2 different types of vitamin C, fish oil and zinc, and to a lesser extent B12 and some other items.
Right.
And usually the child is given those nutritional supplements for a month before we start doing clearing with the homeopathic remedies.
Okay, all right.
Yeah.
So then what was the end result for
So this
Freddie?
child is almost completely recovered now. He just turned 2.
Okay.
He's amazing, actually. It's been a terrific success story. For anybody who is interested in the details, the case is on my site, my website, and it was also published in a homeopathic journal called Simillimum recently.
Okay.
Yeah.
Now, speaking of your treatments,
Yes.
how long are they? usually?
It depends. Now, this is an interesting case with little Freddie here, because in his case, we could track the symptom, the onset of his autism-type symptoms back to the vaccine. And this is what most of the time gets missed, because the vaccine was given on November 19, and he didn't develop symptoms of autism until the end of January, early February, you see. So people say, oh, the vaccines don't have side effects, etc. And it tends to be a gradual, chronic, slow onset more often than something very acute, and that's why it's generally missed.
Okay.
Now, that being said, vaccines are not the only causative or contributing factor to autism. There are many other substances that are suspected. So Tino Smits found that in about 70% of cases, vaccines played a role. But what we usually see is that there are many different stresses that those children have been exposed to, even before pregnancy sometimes, because things that affected their parents, such as health history of the parents, medication used by the parent, things that happen during labor and delivery, such as epidurals, anesthesia, antibiotics for strep B, that sort of thing, and then other things that happen after the delivery, they all tend to be cumulative, and that's why I brought some of these.
Right.
You know, so what we see now more and more is that children are exposed to many different kinds of stressors in the first 2 years of life and in the prenatal period, when their nervous system is exquisitely sensitive.
So your job then is to find out which one or what combination of them are contributing.
And that is what CEASE therapy has really pointed out, is that, you know, a very detailed case history is very helpful to find out, to identify all potentially causative factors, and then step by step you try and basically detoxify them from the system, in addition to supporting the whole system.
Sounds like a very satisfying way to spend the day.
It's you know what, it's so incredibly gratifying. The parents are so grateful, and it's such a joy for me to see those children improve. It's
sure, they have a chance now at life.
Exactly.
Yes.
Yeah.
That's amazing.
It's
I can
really
see why
rewarding.
you've felt dedicated to go on and continue training in
Very much.
this. Yes. And how long have you been doing CEASE now?
So I've been working with CEASE therapy now for 3 years, but as I mentioned before, even before that, I had good results using regular homeopathy and nutrition and so on.
Good.
Yeah.
So folks, if you know of any parents that are dealing with autistic children, or adults who have been let slip through the cracks and are dealing with autism, there is other ways of being treated. And I gather that we're not talking about huge amounts of dollars.
No, not at all. The lovely thing about CEASE therapy is that the remedies are very inexpensive. So a little vial of a homeopathic remedy like this is available for $8 to $10.
Perfect.
And
very affordable.
It's a very affordable treatment. They are really just paying for my time and for a few supplements.
So I'm hearing then that vaccines aren't the only cause of autism, and also you look at other things as well as a causative factor. So when we get back from the break in a moment, we'll have Anke discuss some more other case scenarios with us, other case examples, and we'll go from there. Welcome back. Often in my practice, I've been asked by parents when I am dealing with children whether or not to pursue vaccines, and that is a very tough question, and it's one that most practitioners probably are somewhat uncomfortable in answering. It becomes, I think, in the end, the parent's choice. And of course, to make a choice, you need to have information. So, Anke, I gather you're going to explain to us possibilities of raising a child without vaccines, and then discuss maybe some more case scenarios that you've had.
Yes, what you mentioned is a very valid point. It's a very difficult decision for parents to make, because there's a lot of pressure to vaccinate, and nobody wants their child to suffer and become seriously ill. And I think we have to distinguish between very serious infectious diseases such as polio, meningitis, tuberculosis, hepatitis, those types of things, and more or less ordinary childhood infections, which are relatively relatively benign, and may actually confer benefits down the line in terms of enabling the immune system to mature fully, and also to prevent other chronic conditions later on in life. So ultimately it is the parent's choice, but more and more people are becoming interested in this topic, because as we see now, the countries that have the most intense vaccination schedules, especially the United States and Canada, have not only the highest rates of autism, but also the highest rates of other learning disabilities. Like 1 in 6 children is now diagnosed as learning disabilities. 35 to 40% of children have allergies. Rates of diabetes and so on are rising. So we're looking at many other chronic health conditions which are possibly traced back to the overuse of vaccines, to an underdeveloped immune system, to the overuse of antibiotics, to poor nutrition, to vitamin D deficiency. So all of these different factors seem to be working together to create kind of like a perfect storm that leaves children vulnerable to these developmental disorders.
Okay.
And I'm frequently asked, about these sorts of things like, should I vaccinate, should I not vaccinate? And you definitely want to have something in place to prevent serious illness. And you also want to be able to support the child when they have something like measles or chickenpox with natural methods, so they don't develop meningitis or become seriously ill.
Right.
And there are options available, but as we both know, in regards to nutrition and supplements, osteopathy, etc.
Sure.
Yeah, so I wanted to share another case of a child who actually became autistic from antibiotics. And antibiotics are also in the news a lot these days because, as we know, antibiotics are overprescribed. I just heard on the news the other day that in the United States, every year about 70 million, well, that can't be right. Yeah, maybe it was 70 million. Well, maybe it was 70,000. 70,000 prescriptions of antibiotics are given without really good reason.
That could be 70 million when you
Could
figure
it
the
be
size of the
70
population,
million?
the number
Maybe,
of people.
I don't remember the exact
many
number
though.
right now. Too many anyway.
Too many, yeah.
The average child now has about 18 courses of antibiotics before they're 20 years old. So that's a lot of antibiotics. And as we're learning more and more about antibiotics, we are learning how much they disrupt the natural microorganisms in our bodies, which in turn seem to be a cofactor for autism and other developmental disorders. So it's not just vaccines that contribute to this. I had one child under my care, actually I have 2 children under my care who were never vaccinated and developed autism. One had IV antibiotics when he was 9 weeks old, and then again more intense antibiotics when he was 1.5 years old, and after that developed autism.
Right.
And we actually got him back with a homeopathic remedy made from antibiotics, and there's a shot on they'll show it on the screen. So it was a homeopathic remedy made from antibiotics, and within days his eye contact improved, his digestion improved, and many other parameters improved.
How old was he when he received your treatment?
He was 3 years old when I started working with him.
Wow.
Yeah.
Okay.
Yeah.
Excellent. So then what other things other than antibiotics and vaccines would you look at? What would you suspect?
Many other factors. For example, I have one child under my care who became autistic after a Tylenol overdose.
Accidental?
Accidental. She ate a bottle of Tylenol by accident.
Ah.
The child had already had some other symptoms after vaccinations. So she had some other changes in her health after vaccination. She was less healthy and developed eczema and so on. And then by accident, she ate a bottle of Tylenol. She ended up in the hospital, almost in liver failure. They got her back, but she became autistic after that.
Ah, okay.
And of course, that's a contributing factor. So many children receive vaccines, and then the parents are told if the child develops a fever, which is actually, in our opinion,
response.
a normal and a positive response, right?
Yes, exactly.
The immune system is working. They're then advised to give the child Tylenol,
Right.
which is actually suppressing the normal response of the immune system,
and
is also adding an additional stressor again.
Right.
And research shows that children who receive Tylenol with their MMR vaccine are actually more likely to develop autism than those that don't.
Ah, okay. So the problem is for the parent when their child is in the middle of the night with a high fever.
What do the parents?
Always as a parent. I know both my children had their vaccines a little bit later in life at our choice, and they both developed fevers, and luckily we knew enough to let them go through that, keep an eye on them, and they were fine. But we chose to have them vaccinated later in life.
That's an option as well.
We raised our children in in the rural areas. They weren't being exposed to
Right.
TB or anything that was maybe the inner cities might have.
Yes.
And so we chose to go that route, and they were fine.
Yes. See, that is another thing that parents have an option of doing. They can delay the vaccines or decide not to give so many all at once. It seems to be a cautious thing to do not to overwhelm the immune system at such a young age with too many different vaccines and other factors.
In your opinion, what would be the optimum age to start a vaccination program?
Probably not before 4 to 6 months.
Okay.
And I would be I would certainly break it up and do it much more gradually and pick and choose basically.
Right. We waited
Yeah.
until they were 2.
You could wait longer, absolutely.
Yeah, we were fine with that because we knew they weren't being
Absolutely.
exposed to any pathogens.
Yeah.
Wonderful. So
Yeah.
you'd mentioned another case.
Yes, I have another case. I've got, as I mentioned earlier, actually boys are 5 times more likely to develop autism than girls.
And do they know why?
Yes, probably because estrogen has neuroprotective properties. So boys seem to be more susceptible to neurological damage or injury as a result of that.
Ah.
So in my practice, I only have 2 girls under my care with autism, I had. And the one thing they had in common was both of them were complicated pregnancies, and the mothers received a lot of ultrasounds. And
Interesting.
there's new research showing that ultrasounds may also be contributing to the development of autism.
Through the stress it places on
The stress it places on the developing fetus.
fetus, yes.
Yes.
An emotional stress?
No, physiological stress.
Physiological stress.
As a result of the sound itself, and it actually increases, it causes increased temperature in the tissues that is being treated.
Treated.
Mhm.
My goodness. Now, do you
Yes.
know how many times the mother was
in both of those cases, there were at least 9 ultrasounds. I think one was 9, the other one was 10 ultrasounds.
That's quite a bit.
Yeah, that's quite a bit.
Yes.
So the one girl had symptoms from birth, including fairly severe constipation. And then she received her usual vaccines, and after her 18-month shot started to regress. And that's the most common thing that people see. The child develops quite normally for the first year, year and a half, and then at some point they start to regress. So they were already walking and talking and engaging normally, and then suddenly they're regressing, no longer making eye contact, losing their language ability, no longer able to clap their hands or walk normally, and that is the more typical development in regressive autism.
So then how would you treat that? Because how do you make a homeopathic remedy for an ultrasound?
We actually have one, believe it or not.
Do you?
Yes.
I would
but
have never guessed that.
I didn't either. And at the time Carly first came under my care, I didn't know about it. So I treated her with the first vaccines that she had, which was infant Vicks Hexa.
Okay.
It's this particular one. So it's a 6-in-1 vaccine. And she started to improve almost right away. So her main symptoms at the time were that she would not eat normally. She would hold food in her mouth instead of eating and chewing it. She didn't sleep at night, and she licked the furniture and climbed a lot, like very dangerous climbing up shelves, up the windows and out the windows and so on. And within a very short period of time, that stopped. So she actually ate her food normally. The parents told me that it would take them 20 minutes sometimes to get 2-3 bites into her because she was just holding the food in her mouth, she wasn't chewing it.
Right.
And just that one little thing made a big difference in the family's
Oh, I can
quality of
imagine.
life.
I
Yeah,
can
it was
imagine how
huge.
huge that would be.
And she started sleeping through the night. Her digestion improved. She had had trouble with constipation and diarrhea from birth, and her digestion became normal. She became much more engaging. She stopped the dangerous climbing. She had fallen a few times because she was dangling from this and that. All of that stopped, and she just continued to improve just on this one vaccine. But I suspect that she was predisposed to having a reaction to the vaccine, possibly because she already had all these ultrasounds in utero.
Mm-hmm.
You know, again, as I was trying to point out, it tends to be an accumulation of factors, you know, one thing on top of another and another and another.
Right.
And
Right.
different things in different children.
So what happened then when you gave her the ultrasound or the remedy?
We haven't gotten that far because she improved so much that, and then the family actually ended up expecting, and at the moment I'm not seeing her because they got very busy. The daughter's doing really well.
Okay.
So she has recovered to the point that, you know, life is much, much better for them.
Oh, that's
and
wonderful.
I'm hoping that they will return and will continue to clear her up. But
Certainly.
she dramatically improved just with this one remedy. It was really quite shocking.
Are you using things like vitamin D and fish oils
I
as
use
well?
a lot of that. So fish oil is a big part of CEASE therapy as well because it helps to reduce inflammation in the brain and helps
Right.
to, you know, normalize the membrane function and so on.
Is there any one
And,
particular type of fish oil you recommend?
Not really. sometimes it depends on what the child is willing to eat.
Right.
Like many of these children with autism are extremely finicky eaters.
Right.
For example, this girl I mentioned ate basically just 2 or 3 things. Like she lived on noodles, anything she could swallow whole because she wasn't chewing her food, right?
Okay.
So it can be quite challenging to get nutritional supplements into those children.
Right.
So depending on the child, I might recommend a liquid that is maybe mixed with a fruit puree, or chewables that are flavored with strawberries, strawberry flavor, or something similar.
Okay.
Depending on what they are able to
Because
do.
now in the health food stores they're selling fermented fish oils.
Oh,
and
yeah,
I hear that they are much more bioavailable than the typical
That's
fish oils.
entirely possible. And you know, quite often, even just putting the child on some of those supplements makes a big difference.
Wonderful.
In fact, I had one child who came under my care, and he was 2.5 at the time. I had a little children's chewable in my office that I was trying out, and I offered for him to have one just to see if he would actually eat it.
Yes.
Okay, so he ate just the one chewable, and the parents called me the next day and said, "What did you give him?" He was much better for the rest of the day. We could actually go shopping with him without him having a meltdown.
Wow, that's wonderful.
And he seemed much more engaging and so on. And I said, is it possible? He only had one little chewable vitamin.
Mm-hmm.
So all of those things seem to be helpful to those children.
Wonderful. Well,
Pretty
you've
amazing.
offered us some very interesting alternatives, and
Yeah.
hopefully, folks, if you know of anybody out there that happens to have a child with autism, please keep this in mind. The whole premise of the show, of course, is to offer us choices for our healthcare. Anke, thank you very much for coming on. This has been very fascinating, and
My pleasure.
hopefully it helps more people.
Yes, thank you so much for
You're
having
very
me.
welcome.
It was a real pleasure.
On behalf of the staff here and the crew at Choices, we thank you for watching. We hope it's beneficial for you, and until next time, stay healthy and enjoy your day.